Hello and welcome. You're viewing this recording to learn about the open access publishing model, predatory publishing, and some of the resources that can help you find appropriate journals to publish in. The academic research publishing model is changing. The old subscription based model that has served for over a century is gradually going away. Scholarly and academic publishing is moving toward an open access model where information and research is locked up, or I'm sure to say, where research isn't locked up behind paywalls and subscriptions, but is free to all. In reality, it's not that simple or straightforward, but that is the aspiration of open access as well as its associated movements, open science and open education. I hope the information I'm imparting you to today will give you a better understanding of the open access model and provide you with the knowledge and tools to navigate that new model. This information will not only benefit you if you plan to publish, either as a medical student or as a future doctor, but also as a consumer of biomedical, healthcare, and scientific literature. Searching for and locating evidence based, authoritative, and relevant medical information you need can be daunting, and the more information you have on how the scholarly research publication process works, the better. We'll be covering the fundamentals of open access and the different types of open access publication options. We'll take a look at the problem of predatory publishing, which are essentially unscrupulous publishers that put out deceptive junk journals that exploit the open access movement. They like to target eager postdocs, other graduate level students, including medical students, and faculty, particularly newer faculty unaware that they are paying to publish in journals with little to no academic rigor or quality. We're going to talk about some tools that can help you find appropriate quality journals that you can submit your work to and avoid predatory journals. We'll also touch on help with open access funding for Rowan authors available through the Rowan libraries. Also, much of what we're covering today comes from the Publishing Support LibGuide available on the library's website. Before I get too far, I do want to reinforce what has come down from Dr. Langford and the Virtual Health College Office of Research regarding students submitting works for publications while enrolled at Rowan Virtua SOM. Rowan Virtua SOM students that plan to publish while they are enrolled at this school must have a school approved faculty mentor to partner with on their project, and you will work with them to get the support you need as well as to get your work published. This falls in line with the student research policy as outlined on page 73 of the student handbook. The student research policy is there to protect you as well as the school. It is very important that you are working within a school approved faculty mentor when it comes to publications. So let's talk about exactly what is open access. Open access is a broad, worldwide movement that seeks to make academic information such as research articles and data free and open to all. Open access is transforming the traditional model of scholarly publishing and is working to create a new model that is more equitable, more beneficial to society, and promotes scientific transparency and rigor. Publications are defined as open access when there are no financial and few legal or technical barriers to accessing it. It flips the traditional subscription and pay to access model. Open access removes the barriers to access. There's no paywalls or subscriptions or restrictions on who can access the information. The downside is it can flip the cost to publish, and it flips it to authors and creators of the research and scholarship. Anyone can now read, download, copy, and distribute print the articles or an open access article with few, if any, copyright restrictions. But to get it out there, someone still has to pay. Now, open access is absolutely not about lowering quality or standards. It's about improving and increasing access and the use of knowledge. There is the problem of predatory publishing, which exploits the open access movement and undermines the legitimacy of open access. We'll talk about predatory journals and publishing in a minute, probably in a part two. Open access actually gives authors more control over their works. In the subscription model, an author frequently gives a copyright of his work to the publisher and gets no compensation for his work once he submits it. Now, it would not surprise me if eventually the costs even out. Academic and Scientific publishing is an expensive endeavor that someone has to pay for, and the cost to publish in STEM fields is very expensive compared to the humanities and many of the social sciences. Just to give you an example here, SOM's share of providing access to all the ebooks, the e-journals, the databases, all the clinical tools, and board review resources that you have access to through the library is around $2 million dollars a year. Open access does not make plagiarism easier. With open access, anyone can read it and check it. Instead of having 1,000 people read your work, it could be millions, increasing the chance that someone will catch that you stole someone else's work. Okay. Now, why the move to open access? Open access publishing has been encouraged by the development of open source technologies, government funding mandates, and the just unsustainable increase in the cost, as well as just advocacy for a more equitable and fair um, distribution of the information, or to get it out there so more people can see it. The internet and the growth and development of open source technologies help to make open access become possible. However, it can also be argued that technologies and the internet have also contributed to the rising cost of publishing as well. Governments from around the world, but particularly the US federal government, fund a lot of the research, and it's funded with public monies. Having information and data that was generated from taxpayer funded research locked behind paywalls and subscriptions that basically only those that paid for that access could get to began to not sit well with an increasing number of people, especially as the cost rose. As those costs climbed, institutions also began to ask the question, why are we paying increasingly large sums of money to access information we created? Although I will also add that universities and colleges also deserve a little bit of blame here, as many sold off or closed their in-house publishing units years ago. They basically sold a number of them off. The old university presses have gone away, and colleges and universities sold them to big multinational publishers decades ago. So that's also contributed to the cost or contributed to the change. Open access is a way to address the problem in scholarly communication where information is behind paywalls and subscription journals and databases whose prices keep rising as libraries and university budgets stagnate or decrease. University libraries are forced to pay for the creation of research as well as to buy it back from through subscriptions. It's becoming this unsustainable model. Advocacy has also increased. Advocacy to make information open to all has increased eventually to leading to mandates, and it's what helped contribute to those mandates and laws that are making the publicly funded research open and available to anyone, but it has to be available in some format. Advocates believe that knowledge and research needs to be open to all, regardless of ability to pay. And many doctors and institutions, hospitals, and second and third world countries have limited to no access to all the journals, to all the research, all those databases and books and clinical tools that you have access to that you and other medical students have access to in the U.S. and in other first world countries because they can afford to pay it. And a lot of places in the rest of the world, around the world, they can just not afford the subscription cost, the get through those paywalls because they simply do not have the money. Open access changes that. Open access is about the democratization of information and knowledge. Just to give you an idea, that back in the day when I first started working in medical libraries, I was in charge a lot of the journals that we'd get. We would get paper journals, and once or twice a year, I would pack up a lot of the extra journals that we would sometimes get that would get sent to us. Sample journals. We'd get some extra copies of issues sometimes. Also, some of the journals or articles as they became not as useful to us, but technically still relevant. I actually would pack those up a couple times a year, and they would ship them off to medical schools, to hospitals, over in third world countries, countries in Africa, South America, and Asia, because the medical schools and hospitals in those areas, they just couldn't afford journal subscriptions or they had the money to buy the latest medical textbooks. Open access is all about trying to change that and make all of that information available to everyone. Think about that. Under the old model, once you graduated and went into practice, you'd have to subscribe to the Journal of Osteopathic Medicine, JAMA, maybe be New England Journal of Medicine, perhaps Lancet. Now, you won't have to do that. Now you can just access it. Go to the website and get a hold of the articles. Do a search in PubMed, find a citation, and go right out to the article. No more paywalls. No more having to log in with your Rowan Net IDs. And again, once you leave Rowan, you lose access to all of those journals to begin with. And again, why we're not there yet, and it may be many years before we are, with open access, you don't have to subscribe to or belong to an academic medical center or university or to pay your own subscription to get access to the research and clinical information needed to help you effectively treat your patients. Your patients also now have better access to medical information as well. Having worked in medical libraries for many years, I've encountered the frustration of physicians and patients that didn't always have access to medical research and knowledge within the medical publications because they simply did not have access to it because they did not pay for it. Open access changes that equation. Now, where open access can really get confusing is in the publication types. You may have heard of gold and green open access publishing models before, and they are the two best known. But there is more nuance to it than that, particularly in regards to green, what's called green open access. Gold open access is when the journal is immediately releases and the published manuscript is online for everybody to see. Gold open access journals normally charge a fee called article processing charge, or APCs, as what you'll commonly hear them referred to. The APC could be written into a grant or perhaps paid by the institution, by an organization, by an outside agency, or that is sponsoring the research, or it could fall to the author to pay that APC. With hybrid journals, the publisher allows authors to make a choice to either pay to make individual articles open access or to go the more traditional route to allow the article to only be accessible to subscribers of the journal. Hybrid differs from a gold open access journal, or I should say, hybrid open access differs from a gold open access journal because a library or other subscriber is still paying for a subscription to the journal. So effectively, the publisher is paid twice for the article, once via the subscription and once via the APC to make the article open access. As you might expect, the big commercial publishers prefer this type. But some of the mandates about publishing in open access may not permit using the hybrid type. And that's what also adds to confusion is that some of these mandates regarding that, if you take accepted public funds to do your research and the exact type of open access or that mandate may govern as to what type of open access publication type you can use. Now, also, not all open access journals charge a fee. These are referred to as diamond or platinum open access journals. The cost is usually covered by the institutions that are publishing the journal, or perhaps through endowments, possibly even philanthropy or other means. And there is usually little to no cost for the authors. The Journal of Osteopathic Medicine, the official journal of the AOA, is a diamond open access journal. So there are no APCs to publish in the Journal of Osteopathic Medicine. Your manuscript just has to be accepted for publication. Bronze, you don't see as much. You can read the articles free online, but you can't download or print them, and distribution of the article would require permission and/or a fee be paid to the copyright holder, which is frequently not the author of the article. Luckily, you don't see, or I shouldn't say luckily, but you don't see bronze open access journals as much as you once did. Most are usually either some form of gold, a hybrid, diamond, or green. Green open access is when the author retains the copyright to deposit a copy of the article in a digital repository, usually after an embargo period. The article may be published in a subscription journal or as a hybrid article, but a copy of the article, normally either a pre or post print version, can be uploaded to a publicly accessible digital repository. Sometimes there is an embargo period of a few months to a year before the article can be available in the digital repository, though. You have to be aware of this because if you're doing, again, grant funded or publicly funded research, they may have rules as to exactly what type of open access publication type you can use and where and how you can archive your article. Now, I'm really not going to get into the idea or get into the concept of digital repositories. It can get complicated. There's a lot to them, but just understand that most major universities have their own institutional repositories where their researchers, faculty, and students can deposit and archive scholarly works such as open access articles, posters, conference presentations, etc. For now, just be aware that at Rowan University, the institutional repository is called Rowan Digital Works and is actually managed by Rowan Libraries. If you present, have a poster, or publish in an open access journal that is not deemed predatory, it can be added to Rowan Digital Works. Okay, we are going to end here. This is going to be considered part one, and I'm going to join you in part two, where we will discuss predatory publishing and also go over the tools that could help you avoid predatory publishers and also help you find journals that you might want to submit your work to. So stay tuned and go ahead and get ready to watch part two. Thank you.